Welcome everybody to Maija Bradford's presentation, Decolonizing Mental Health, a journey of understanding. I've been really looking forward to this presentation, and I'm going to be very good. I'm just going to read a quick bio for Maija. Maija Bradford is a clinical therapist working in private practice since she graduated from Northwestern University MA counseling program in 2021. She has her MBA, and before her studies in counseling, retired after 27-year career in the financial industry. At 6, Maija was introduced to the subtler energies in life and answered the healer's calling. As she grew, she realized that her gifts could be misunderstood in this Western culture, so she learned to let them recede. Mrs. Bradford is a Haitian woman that comes from a lineage of African diaspora healers that have suffered from collective generational trauma. She has been the victim and has witnessed individuals that the counseling industry has misdiagnosed, mislabeled, and sustained through treatment plans and medication that do not take the client's ancestral cultural into perspective due to the lack of colonized views, theories practiced in the counseling field.
Thank you. Thank you. Hi, everyone. So I was telling everyone earlier, bear with me. I'm nervous. It's my time to come out. So, bonsoir. Bonsoir. And now, remind you that your breath. So most people would think I'm an African-American woman, which is okay under normal circumstances. But when I'm going to seek some help for my psyche, it's imperative that the professional helper, the therapist, the psychiatrist, they understand who and what I am. And that's the whole basis of this conversation. I want to share my story, and I want to invite you to participate in this conversation of trying to include diversity into the mental health. We've made some strides. Now we have diversity inclusion, so much so that now we ask for pronouns. Like when you guys checked in, right? They asked about your pronoun. That was not common. That was pronoun. I got so excited that I see they and them. I'm like, oh, I can include my people when I talk about myself. So this conversation is long overdue. It's time that we as professional helpers in the United States recognize that Western cultural biases in our conventional education supports an Eurocentric, colonized thinking towards indigenous spiritual healing, which affects treatment provided to our clients. From a numeric perspective, the Western culture is actually eccentric, right? It's kind of like everybody's really trying to find their roots. Everyone is trying to see something different, right? But when we talk about education about mental health, you don't see it that much. Our textbooks and our curricula in psychology, research finding is very implicit to psychology theories based on almost the entire assumption of a European American culture. These assumptions are usually so embedded that we as a society have become blind to them. The consequence of this unexamined assumption is creating institutionalized racism, supremacy, and religious intolerance. Today, I would like to share my journey, and I would like you to understand that this is just a perspective that I found my voice to say, but there's a lot of people who don't have the voice to even express this.